Next, heat exhaustion. And these more serious. They could reflect all the fainting symptoms like giddiness, nausea, vomiting, cold and clammy skin. But the cause is different. It's not a temporary shock. They have been doing some activity like a run, route march, or heavy exertion where they have lost too much of body fluid. This is serious because it's a electrolyte imbalance. These are dehydration issue. Hence, you have to bring them to a cool place, give them isotonic drink. If it works, good. If it doesn't work, call ambulance, send them to hospital. They need a drip. If it delay heat exhaustion case, they could turn into heat stroke, and that's a fatality. Next, heat stroke. If it turn into heat stroke, how would you know? They could stop sweating, hot and dry skin, they are no more conscious, alert. They are confused. They can wake up and fight with you, or totally unconscious. If they are still conscious, they will experience tropic headache. Call ambulance immediately. Bring them to a cool place. Put ice pack on the areas where there are major arteries. Example, forehead, neck, armpit, groin. Ambulance must come as soon to set the drip to save them. And probably they stay for a few days to a week in hospital. They could go into complications like multiple organ failure due to too long dehydration. Next, asthma. Asthma is a medical condition. They are already asthmatic, but the trio could be dust, chemical vapor, even some animal fur, or some even perfume, and some food which could trigger, or sometimes exercise. They got wheezing sound, difficulty in breathing, they can't talk. Worst cases, they go into cyanosis, the lips will turn blue. Use the inhaler early. Usually they have a spacer where they puff one and breathe 6 times slowly, in and out. And wait for 1 minute. If you don't really get another dose, they will know what to do because it has been prescribed by their doctor. If you don't work, call ambulance, send to hospital. They need drugs intravenously. Next, severe allergy. This is a condition where you're allergic to some drug, food, or even some insect bite. This group of people, the reaction could be delayed after 2 hours, sometimes immediately. What are the telltale signs? They complain of rashes and turning into swelling, and the lips, even the tongue can swell. There are not difficulty in breathing, and this you got to call ambulance straight away and explain to the paramedic. This is a anaphylactic shock or severe allergy. Sometimes they carry a drug called EpiPen. You can assist them to use and jabbing it in their thigh without taking the clothing. And still must send them to the hospital where they need to have a rest to recover, to get everything back to normal. Remember, severe allergy can kill. Next, hyperventilation. This is a condition most first aiders could do mistake. Example, construction worker or any worker opening up a cement bag. They inhale the dust and they got an asthma attack. They're breathing very fast. Their legs and hands are all cramped and they got difficulty breathing or fast breathing. This is an asthma attack, but some first aiders think it is hyperventilation. They ask them to breathe slowly, thinking that it works. If it is an asthma attack induced hyperventilation, it's different. You have to call ambulance. They need a inhaler, ventilator inhaler to open up the lungs. Okay.